Last year was a very, very trying time in my life where I thought I was going to die. I broke down. I have battled chronic kidney disease for years, about 12 years now. My chronic kidney disease started from drug abuse, first of all. Actually, at a point, I had painkillers in my wallet.
This is Ufuoma. She's a successful Nigerian actress, always growing on the screen. I mean, Ufuoma has been an household name for a really long time. But just months before, just a few months ago, during a routine medical checkup, she got a call from her doctor that would change every single thing. You have stage 2 chronic kidney disease. We need to talk. I mean, the most terrifying part about this whole thing is what caused this situation or what caused this condition for Ufuoma is what millions of us take every single day. Painkillers. So let's rewind. Years before the red carpet, years before Ufuoma became a very famous person, before anyone even know who she is, she was just a student, and sometimes she could be stressed, she could be overworked, and she's got a lot of long nights reading with laptops. And during this period, she noticed something really peculiar. She started having migraines, blinding, pulsing headaches that made it very hard for her to study, let alone even think. So she went to a doctor, and doctor did a couple of tests, and they just realized it's just an eye strain, and all she needed was glasses, all because she's got what we call myopia, short-sightedness. But Ufuoma, although agreed, she didn't really like the idea of having glasses because it made her look like a geek, made her look like a nerd. And although she took the glasses from the doctor, she found her own solution. Painkillers. Let me just use a couple of paracetamol, diclofenac, one at a time. Sometimes I'll just take it, chuck it up, and I'll feel much better. That is what Ufuoma thought. Then, over a period of time, she started using more. It wasn't really an addiction, it was just about survival. Or at least that is what she felt as at that time.
Wait, what was this?
Years later, Ufuoma had made it. She's now really very famous. She's been living the dream, acting in Nollywood and, blockbuster, traveling around the world and doing interviews. One day, she decided, let me just get a routine checkup. She did the test, she went back home, then her phone rang. Her doctor's voice, very calm. At least too calm compared to what Ufuoma is used to. Then the doctor said, your kidney is working below what they should. We really need to talk. They did further tests, and this test confirmed it. She has chronic kidney disease. The question is, why? Why has this happened? Here is what really shocked her. She felt nothing. She felt no fatigue, no headaches, no swelling. She had no warning sign. Basically, she felt fine. She only didn't feel fine, she looked fine. So, where is this whole kidney disease coming from? Now, this is the thing. According to the CDC, 9 out of 10 patients with chronic kidney disease, or at least early stage disease, doesn't really know they have it. And this is because the kidneys are silent workers, filtering blood, filtering fluid, removing dirt around the body. They are very, very quiet, sometimes even too quiet. But when there is a problem, all they do is whisper. And when they whisper, it might be too late. So let's break this down. A very popular painkiller like ibuprofen belongs to the class of drugs called non-steroidal anti-inflammatory drugs. And what they basically do is block the enzyme that are actually responsible for pain and inflammation, which really sound great. You feel better because it's able to block this. But whilst they are blocking the enzyme responsible for pain and inflammation, they can also reduce blood flow to the kidney. It's okay when you use them once in a while, but when you use them for too long, this continuous, consistent reduction in blood flow to the kidneys can be really consequential. A 2019 study by the International Kidney Report found that regular NSAID use significantly increases the risk of chronic kidney disease, especially if the patient has other conditions such as diabetes, high blood pressure, or any form of family history. And that is when Ufuoma actually remembered she does have a brother that has this condition. her older brother suffers from chronic kidney disease. So Ufuoma, by default, is at risk. Thankfully for Ufuoma, she was able to catch it early. Stage 2 kidney disease just basically means although the kidneys are not working properly, they are still able to work long term if proper adequate care is made. So she made big changes, including no more NSAIDs, good diet, a lot of water. Drinking a lot of water does help the kidney function properly. And just going for the regular checkups. I mean, this is the best thing you can ever do for your health. But for most people, they are not really going to catch it this early. The kidney could be functioning well perfectly today, and by the next time they are having symptoms, they have to be on dialysis or probably worse. So if you are listening to this and thinking, wait, I use painkillers every time, here is what you need to know. Don't use painkillers, especially NSAIDs, for more than 10 days. And importantly, you always need to revise your medications with your doctors. Drink a lot of water. Monitor your blood pressure, especially if you are hypertensive or you've got any family history of kidney disease. And because kidney damage doesn't really come with pain, it's very easy to ignore. And for this reason, people just end up in a really bad situation. Apart from conditions like kidney disease, there are so many other ways people have died. I mean, look at this story that I made in my last video about a nurse who was actually killing some of his patients and ended up killing over 300 patients. You can check out that video and so many other videos I've actually done on this channel. Remember to like and subscribe to this channel because everything we talk about here is all about health. I'm Dr. B, and always keep in mind, health is wealth.